Hello everyone, welcome to my channel. So in this video we will study chapter 6 physiologic form of tooth and periodontium of subject dental anatomy from Dental Pulse. So let's begin. So question 1, the mesial contact area of the permanent canine is at the, so its answer is option B, junction of incisal and medial thirds. Let's see its explanation. Contact area of upper teeth. So central incisor, its mesial surface, contact at incisal third, and distal surface, contact at the junction of incisal and middle third. We know that the tooth can be divided into three halves: incisal, middle and cervical. So this is the incisal third, this is the middle third, and this is the cervical third. So the central incisor, its mesial surface, contact at incisal third, and its distal surface, contact at the junction of incisal and the middle third. The lateral incisor, if we talk about lateral incisor, the mesial surface, contact at the junction of incisal and middle third, and distal surface at middle third. Canines, mesial surface, contact at junction of incisal and middle third, and distal surface, contact at middle third. Now first and second premolars, the mesial surface, contact cervical to the junction of occlusal and middle third, and distal surface, contact at cervical to the junction of occlusal and middle third. Both are contacting at the cervical to the junction of occlusal and middle third. Now first molars, the mesial contact is at cervical to the junction of occlusal and middle third, and distal contact is at middle third. Second and third molars, mesial contact is at middle third and distal is also at middle third. So this was about the contact area of maxillary teeth. Now question 2, largest embrasure lies between. So its answer is C, maxillary canine and first premolar. So let's see its explanation. When the two teeth contact in same arch, their curvatures adjacent to contact areas form spillways spaces called embrasures. As the distal slope of canine is too long and also the first premolar has a long medial slope, this makes the contact at a high level on the crown, opening a wide occlusal embrasure. Smallest embrasure lies between central incisors. Widest incisal embrasure lies between central incisor and canine. Question 3. The largest embrasure in posterior teeth is the. So its answer is option C, lingual. Okay. From the occlusal aspect, anterior teeth will have their contacts centered labiolingually. In case of posterior teeth, the contact areas are present slightly buccal to the center buccolingually. Also, their lingual surfaces are converged, resulting in wider lingual embrasures. But in case of maxillary first molar, the lingual surface is wider than facial surface, resulting in a small lingual embrasure. Okay. Now question 4. The tooth that is commonly seen in the abnormal relation and contact with its adjacent teeth of the same arch is. So its answer is option D, maxillary lateral incisor. Maxillary lateral incisors vary in form most commonly. This makes the existence of an abnormal relation and contact with its adjacent teeth. Okay. Now question 5. Divergence from contact area in proximal surfaces causes embrasures. Options are facially, option B lingually, option C cervically, option D facially, lingually, cervically and occlusally. So its answer is option D, facially, lingually, cervically and occlusally. So the curved proximal surface of the contacting teeth roll away from the contact area, creating embrasures occlusally, cervically, lingually and labially or buccally. Okay. Now question 6. The contact area on the distal surface of a maxillary first premolar should be placed in. Option A, middle third of proximal surface with lingual embrasure greater than the facial embrasure. Option B, occlusal third of proximal surface with the lingual embrasure greater than the facial embrasure. Option C, occlusal third of proximal surface with facial embrasure greater than lingual embrasure. Or option D, middle third with facial embrasure greater than the lingual embrasure. So its answer is A, middle third of proximal surface with lingual embrasure greater than the facial embrasure. Question 7. The widest incisal embrasure is normally found between which of the following permanent maxillary teeth? So its answer is lateral incisor and canine. We have studied about it in question 2 also, that in anterior teeth the widest embrasure is present between lateral incisor and canine. Question 8. Distal contact of upper first premolar is. So its options are: option A, lower than mesial contact area. Option B, little cervical to junction of occlusal and middle third of crown. Option C, higher than mesial contact area. Or option D, A and B. So its answer is option D, both A and B. Now question 9. An imaginary occlusal curve that contacts the buccal and lingual cusp tips of mandibular buccal teeth is called the. So its answer is Wilson curve. Curve of Spee, it refers to the antero-posterior curvature of the occlusal surfaces beginning at the tip of lower cuspid and following the cusp tips of the bicuspids and molars, continuing as an arc around the condyle, through the condyle. Curve of Wilson, this is a curve that contacts the buccal and lingual cusp tips of the mandibular buccal teeth. It results for inward inclination of the lower posterior teeth. As the teeth are aligned parallel to the direction of medial pterygoid, there is optimum resistance to masticatory forces. Another question on the same topic is asked: linear curve which runs anteroposteriorly in anteroposterior direction is curve of Spee. Okay, now question 10. Mesial contact area of the permanent canine is at the. So its answer is option B, junction of the incisal and middle third. We have studied about it in previous questions also. Now question 11. Generally, contact areas between posterior teeth are located in which directions from the center of the proximal surface? So its answer is A, facially and occlusally. Generally, contact areas between posterior teeth are located in facial and occlusal directions from the center of the proximal surface. Now question 12. Which of the following do not contribute to arch stability? So its answer is option C, embrasures. Embrasures serve as spillway for the escape of food during mastication, a physiologic form which reduces forces. It prevents food from being forced through the contact area. Now question 13. The contact area on the distal side of a maxillary first premolar is located. So its answer is little cervical to the junction of occlusal and middle third of the crown with wide occlusal embrasure. Okay, we have studied about it in question 1 explanation. So now question 14. Contact areas of anterior teeth which are placed in center of middle third. So its answer is distal contacts of maxillary laterals and canine. Now question 15. Which anterior teeth have both mesial and distal contact area at the incisal third? So options are mandibular centrals, option B mandibular laterals, option C both A and B, option D none. So its answer is option C both A and B. Question 16. Which 4 mandibular teeth are so aligned that when viewed from occlusal, a straight line may be drawn bisecting the contact areas? So its answer is option A, 5, 6, 7, 8. Second premolar, first molar, second molar and third molar. Now question 17. Which teeth show less curvature on the crown above the cervical line than any other teeth? Option A maxillary anterior, option B mandibular canine, option C mandibular anteriors, option D maxillary canine. So its answer is option C mandibular anteriors. Question 18. Which of the following are the functions of contact areas? Option A, distribution of occlusal stresses. Option B, protection of periodontium. Option C, stabilization of dental arches. Option D, all of the above. So its answer is all of the above. Question 19. The distance from the CEJ to the alveolar crest normally is. So options are 1 to 1.5 millimeter. Option B, 2 millimeter. Option C, 2 to 2.5 millimeter. Option D, 3 millimeter. So its answer is option A, 1 to 1.5 millimeter. Question 20. Buccal surface of the posterior teeth are wider than the lingual surface mesiodistally except in. So answer is option A, maxillary first molar. Okay. Now question 21. Posterior embrasures are generally larger on the lingual than on the facial, with the contact area within the facial moiety except between maxillary. Option A, premolars. Option B, first and second molar. Option C, first premolar and canine. Option D, first molar and second premolar. So its answer is option D, first molar and second premolar. Now question 22. Protective crests of contour on buccal and lingual surfaces are found in the middle third of the lingual, nearest the occlusal third of the lingual, in the cervical third of the buccal, or both A and C. So its answer is option D, both A and C. Crest of contour or curvature of the labial and buccal surfaces are at the cervical third, and lingually the crest of the contour will be at the middle third of the crown. Okay. Question 23. The interdental papilla is located in the option A, facial embrasure. Option B, lingual embrasure. Option C, cervical embrasure. Option D, occlusal embrasure. So its answer is option C, cervical embrasure. The interdental papilla occupies the lingual embrasure just below the contact point and above the crest of the alveolar bone. Question 24. All are true about calciotraumatic line except option A, due to caries. Option B, due to death of osteoblastic layer. Option C, it remains after caries is removed. Option D, because of odontoblastic migration from cell-rich zone. So answer is option B, due to death of odontoblastic layer. All are true except this. So let's see its explanation. During advanced stages of caries, walls of the individual tubules undergo further decalcification, leading to their confluence. Along with this, there is an increase in the diameter of the dentinal tubules. This occurs due to packing of the tubule with microorganisms. Small liquefaction foci are formed by the breakdown of a few dentinal tubules. This focus is an area of ovoid destruction parallel to the course of the tubules and filled with necrotic debris that tends to increase by expansion. This produces compression, distortion, and disruption of the adjacent dentinal tubules. Teeth with deep penetrating carious lesion can be treated only by partial removal of the deep carious lesion and insertion of calcium hydroxide or mineral trioxide aggregate containing dressing materials for a period of few weeks or months. During this period, the odontoblast form new reparative dentine along the pulpal surface underlying the carious lesion. The cavity can be reopened and the remaining carious lesion removed without endangering the pulp. This treatment is known as indirect pulp capping. On removal of the caries, the mesenchymal cells of the cell-rich zone differentiate into odontoblasts to replace those that have necrose. These newly formed odontoblasts can produce well-organized dentine or an amorphous, poorly calcified, permeable dentine. The demarcation zone between secondary and reparative dentine is called calciotraumatic line. Okay. Now, question 25. The primary center of formation of each lobe is present in. So, its answer is option B, tip of the cusp. Primary center of formation of each lobe is present in tip of cusp. Question 26. The facial-lingual angulation of the upper central incisor is approximately. So, its answer is option B, 28 degree. Facial-lingual angulation of the upper central incisor is approximately 28 degree. Question 27. In primates, a tooth with single conical cusp and single root is seen in. So its answer is option A, haplodont. Okay. Now question 28. The biting forces at molar region during mastication is? So its answer is option D, 90 to 200 pounds. The biting force at molar region during mastication is 90 to 200 pounds. So biting force on molar region is 90 to 200 pounds or 400 to 890 Newton. On the premolars it is 50 to 100 pounds or 222 to 445 Newton. On the cuspids it is 30 to 75 pounds, that is 133 to 374 Newton, and on the incisors is 20 to 55 pounds, that is 89 to 111 Newton. Okay, so the biting force at molar region during mastication is 90 to 200 pounds. Question 29. The curvature of the cervical line of most teeth will be approximately. So its answer is option B, 1 millimeter less distally than mesially. Okay, curvature of the cervical line of most teeth will be approximately 1 millimeter less distally than mesially. Question 30. All embrasure spaces are reflections of the option A, form of the teeth involved, option B, size of the teeth involved, option C, eruption sequence involved, or option D, none of the above. So its answer is option A, form of the teeth involved. Question 31. The term contact point, which is often used to designate the contact of the tooth in the same arch, is a question. So options are synonym, option B, antonym, option C, misnomer, or option D, levonomer. So its answer is option C, misnomer. Contact area is better term than contact point. So contact point is a misnomer. Question 32. The embrasure area in the following areas are continuous. Option A, labial and lingual, option B, lingual and occlusal, option C, incisal and occlusal, option D, labial and occlusal. So its answer is option A, labial and lingual. The spillway spaces or embrasures that widen out from the area of contact labially or buccally and lingually are called labial or buccal and lingual embrasures. These embrasures are continuous with the interproximal spaces between the teeth. The incisal or occlusal embrasures and the labial or buccal and lingual embrasures are continuous. Now question 33. In ideal occlusion, the facial cusp of maxillary posterior teeth oppose. Option A, grooves and embrasure, option B, marginal ridges and embrasure, option C, grooves only, option D, marginal ridges only. So answer is grooves and embrasures. In class 1 molar relationship, the mesiobuccal cusp of the first permanent maxillary first molar is located within the mesiobuccal developmental groove of permanent mandibular first molar. The triangular ridges of maxillary buccal cusp of premolars and molars occlude with the buccal embrasure of mandibular premolars and molars. Okay. Now question 34. Cusp fossa and cusp embrasure relationship is given or popularized by. So its answer is option B, Huffman and Regenos. So let's see its explanation. Shepard gave anterbolus exit balance concept. Devon gave neutrocentric concept. Stallard and Swart gave organic concept of occlusion, and Huffman and Regenos gave cusp fossa and cusp embrasure relationship. Now question 35. Which of the following factor does not contribute for maintaining occlusal stability? Option A, embrasure, option B, tooth structure, option C, loss of teeth, or option D, periodontal disease. So the answer is option A, embrasures. The stability of the occlusion and the maintenance of tooth position are dependent on all of the forces that act on the teeth. Occlusal forces, eruptive forces, lip and cheek pressure, periodontal support and tongue pressure are all involved. As long as these factors or forces are balanced, the teeth and the occlusion will remain stable. The loss of the teeth, tooth structure, or occlusal supporting cusp, or a decrease in their support from periodontal diseases or trauma is a factor in maintaining occlusal instability. Question 26. The term connectors or interdental contact area refers to. Option A, contact point between the adjacent anterior teeth, option B, contact point and the area above and below the contact point between the adjacent teeth, option C, contact point between and adjacent posterior teeth, option D, embrasures, incisal and gingival to the contact. So its answer is option B, contact point and area above and below the contact point between the adjacent teeth. Okay, so we have done all the questions of this chapter. So if you like this video, do like and subscribe to this channel. Thank you so much.